Hi there, I'm Bonnie Adam. I'm a registered acupuncturist and a certified cupping therapist, and I'm doing a little demonstration today of cupping therapy on the back. And this is our lovely volunteer Ida, who has had her cups on her back now for about 10 minutes. And I'm just going to show you what they look like. We've been keeping her nice and covered up and warm. You can see that there's a little bit of redness, almost on the verge of purple in some of these cups. And there are going to be some pictures as well on the website that you can look at if you want to get more of a close-up version of this. The reason we do cupping is because it's very beneficial to stretch and release stuck muscles and tightness in the back. It's also really great for detoxification and immune system boosting. And you can see as the cups are working here, I like to do a little bit of massage with them just by dragging them around. And this is going to further loosen up all the muscles in her back, and sometimes they just pop off like that and pop it back on. And that's an indication too that maybe she's got a little bit of tightness here because the tissue doesn't want to suction up inside the cup. So I'll just keep working this area a little bit while we talk. And this feels really nice and relaxing. Cupping should never be painful. If it's painful, then the person is being too aggressive. Sometimes people are a little bit concerned, a little bit of fuzzy there, about cupping because they may have seen pictures of people on the internet or in the media where they have these big marks on their back. And you can have a little bit of marking, and it's okay. It's not bruising. It's stagnant blood and tissue coming up to the surface, and when it does that, it's actually a really healthy thing. That means that now it's coming out of your body, out of your organs, comes up to the surface, and then your skin and your dermis can flush that out. And that's one of the things that's important to do in cupping therapy, is to do lymphatic drainage at the end of the treatment. And that involves dragging the cups off like this to the side of the body, to the underarm area, and maybe down to the hip area, so that any toxins that have been released during the treatment can go into the natural lymphatic areas to be cleared. It's really interesting too. Acupuncture and cupping work really well together. You can have acupuncture by itself, cupping by itself, or we can combine them. So we could have some needles in the arms and legs while we're working cupping on the back. This one's sliding really easily. It's almost going to come off, so you can give it a little pump up. The interesting thing about the marking too is that if you were to come for cupping maybe every week for a few weeks, the marking would be less and less the more you come, because you have fewer toxins sitting in your body that are coming out. How does it feel, Ida?
It feels great.
It feels really nice. One of the few therapies I cannot do on myself. So I get regular cupping treatments with a friend who's another acupuncturist. We have a whole set of very important acupuncture points that run along the length of the spine. So all of these acupuncture points are stimulated during this process. This one's going to loose. Some people who should not have cupping done, it's safe for almost everyone, even little children. I've done cupping on small children. But if you're pregnant or if you're undergoing chemotherapy, it's not a good idea. If you have slipped discs or injuries in your spinal cord, you need to be very cautious about cupping. Not that it can't be done, but you need to make sure that your therapist knows that. And anybody who has like a severe infection in the blood should also not have cupping. So anything where you have a systemic infection or systemic things that maybe should not be pulled around in your body, those are the people who should avoid cupping. But other than that, it's really a very safe and invasive treatment. And I'm just going to finish this off with the lymphatic drainage. Lovely little. So I'm just going to pull all of the fluid and everything that's been released in the treatment over to the sides. And I don't think you're going to have very many marks at all, Lita, because you might have a couple little red spots, but you probably won't have too much to worry about. And if you do, you have interesting stories to tell your friends. Oh, I'm losing my section. And I like to just give a little nice relaxing little rub at the